Well, it's so important that we prioritize patient voices, and that's why it's especially important that there's so many voices of lived experience and patient organizations and patient voices here at ICHOM 2024. In essence, ICHOM was founded on the principle that we need to measure outcomes that are important to patients, and we can't do that unless we have them involved as co-creators and really understand what's meaningful to patients and families. And that is the genesis of outcomes measurement. So it's fitting that we have almost 10% of our delegates here at ICHOM 2024 representing that lived experience expertise. The landscape for value-based healthcare has changed so much in my first year here at ICHOM. When I joined last August, I really was a long-term acolyte of patient centricity and the importance of patient lived experience to really understanding value in healthcare. But we've seen enormous trends happening over the last year. We see a rise in attention to patient-reported outcomes. We see a focus globally on the importance of social participation. And we see examples all around the world of clinical practice, whether it's in far Asia or in the South America, Africa, in the Middle East. And these are leaders, true champions of healthcare and value-based healthcare. And so that's an enormous growth over the course of a year. I think this time next year, I hope we're talking about actual impact, that we're showing even more examples of where the work that's starting now has taken root and brought back data that really shows the world that value-based healthcare that's focused on patient-centered outcomes is the way to achieve both quality and cost efficiency and to reduce the burden on our workforce that so desperately needs to work at the top of their training and to deliver truly better health for everyone. I'm really excited to talk about all the future ICHOM programs that we're developing now and the ideas that we have for the future. This year we announced two major partnerships, one with a longtime ally of ours, Capadev, to really expand and scale our ICHOM accreditation program, which is really about helping organizations understand their maturity in implementing value-based healthcare using the ICHOM standard sets. And the second program that I'm really excited about is our collaboration with Scott Wallace and Elizabeth Teisberg and all their colleagues on the ICHOM Education Initiative, which we really think is an important part of certifying what does good leadership look like in the value-based healthcare movement, and how do we know that we are championing that in all corners of the world. As far as other programs that we're looking at, we have learning collaboratives where we are trying to emphasize shared learning and really bring the data to bear in a global way so that people understand that value-based healthcare really does have traction and it delivers results that are not just good for the health system, but it's fundamentally good for people. You know, the ICHOM conference is a cornerstone for the value-based healthcare community. The energy here, the community of practice that this brings from all 6 continents. We have 47 countries represented here at ICHOM 2024. And this conference is really a place where we can bring learning, shared learning, where we can explore new boundaries and challenges that exist in the implementation of value-based healthcare, where we can talk about the impact of ICHOM standardized sets, and where we can explore what the future looks like together.